Unit 12 test questions. 76. A client is admitted to the visiting nurse service for observation after being discharged from the hospital for new onset congestive heart failure. The nurse teaches the client about the dietary restriction that must be followed. Which statement by the client indicates that further teaching is needed? 1. I am going to have a ham and cheese sandwich and potato chips for lunch. 2. I am going to eat myself daily to be sure I don't gain too much fluid. 3. I can have most fresh fruits and fresh vegetables. 4. I am not supposed to eat cold cuts. The correct answer is 1. I am going to have common cheese sandwich and potato chips for lunch. 77. A nurse is performing health screening of a 54-year-old client. The client has a blood pressure of 128 by 82 mmHg, total cholesterol of 190 mg per dl, and fasting blood glucose level of 184 mg per dl. The nurse interprets that the client has which of the following modifiable risk factor for coronary artery disease? 1. Hypertension. 2. Glucose intolerance. 3. Age. 4. Hyperlipidemia. The correct answer is 2. Glucose intolerance. 78. A nurse is trying to determine the ability of the client with myocardial infarction to manage independently at home after discharge. Which statement by the client indicates that the client may have the most difficult after discharge? 1. I don't have anyone to help me with doing heavy housework at home. 2. I think I have a good understanding of what all my medication are for. 3. I will be sure to keep my appointments with the cardiologist. 4. I need to start exercising more, improve my health. The correct answer is 1. I don't have any help me with doing heavy housework at home. 79. A nurse is performing an assessment of a client admitted to the hospital who was diagnosed with toxic shock syndrome. Which of the following assessment questions would assist the eliciting more specific data about the cause of this syndrome? 1. Have your menstrual period is been irregular? 2. Do you use tampons during your menstrual period? 3. Have you been consuming a high intake of green leafy vegetables? 4. Did you start your menses at an early age? The correct answer is 2. Do you use tampons during the menstrual period? 80. A nurse is reviewing the laboratory results of a client who arrives at healthcare clinic for follow-up. After insertion of a mechanical prosthetic heart valve, the international normalized ratio is analyzed. Because the client has been taking warfarin sodium since discharge from the hospital, the nurse would determine that the INR range is appropriate if which of the following were noted as the laboratory results? 1. 2.0, 2, 2.3, 3, 3.0, 4, 5.0. The correct answer is 3, 3.0. 81. A nurse is reviewing the mechanical record of a client transferred to the medical unit from the critical care unit. The nurse notes that the received therapy while in the critical care unit. The nurse would suspect that the client receiving this therapy for which of the following condition? 1. Congestive heart failure. 2. Cardiogenic shock. 3. Pulmonary edema. 4. Aortic insufficiency. The correct answer is 2. Cardiogenic shock.